So talking about all this food and the classifications and how it's been defined in Ayurveda brings me to a question where I want to know, is there any specific diet for, you can pick any disease. How would an Ayurvedic practice suggest a person to follow a specific diet for any ailment? Can you talk to us about it?
It's a very good question. So here, the specific diet comes for a metabolic disorder, or it may be infectious disease. So now I would like to tell you one particular infectious disease, which is known as Raja Yakshma. Raja means king. Yakshma means disease. It is the king of diseases, which is correlated to pulmonary tuberculosis. Okay, sir. In this, the diet for this patient is, if he has got good appetite, okay, so this goat meat soup is very good for him. And along with goat meat soup, he has to take this Raktashali, red rice, and then Shastika Shali, so 60 days yield rice. Yes. Okay. And he has to consume. While preparing this goat meat soup, to that ghee is added. One most important thing in Prakshepaka Dravya, which gives a hype, that is this long pepper, pipali. Have you seen long pepper?
I've seen the regular peppers, honestly.
You have seen the black round pepper. Yes. It is generally used, whereas in case of preparations which need to nourish the body, you need to use long pepper. Okay, extensively grown in our South Canara, in Western Ghats, in Kerala. It is known as pippali. In Kannada it is called as hippali. So that powder is added, and this maricha, pepper, corn, black, is removed. It is not added. Okay, you can add ginger, dry ginger. Okay, the time of Ayurveda, maybe in those days, there was no chili in India. It is an exotic brought to India from foreign countries, maybe South America. Okay, so this has to be given. To this, raw pomegranate juice has to be added, and how much he feels to take, so much he has to consume, eat. Okay, and then this is for non-vegetarian, that he can take every day. Suppose if it is vegetarian food, here green gram dal soup and horse gram soup are most important. That too in nourishing the body in case of tuberculosis. That means it is called as shosha. It's a combination of all diseases. Okay. There you have to add kulatta, that means horse gram. Okay. And one more interesting thing is you have to add plenty of ghee. As per his digestion power, the patient's digestive power, you have to give excess of ghee. Maybe you can give prior to food, you can give after food also. Medicated grita, medicated ghee has to be given. So here you should know that two important things. One is protein food, ajamam sarasa, then horse gram, And then green gram dal, all these are rich in proteins. Okay. So it is given, and grita is given. More grita has to be given, how much he can digest. Okay. And suppose the patient feels thirsty. See, you have to keep in your mind, when the patient feels thirsty, he has to be given hot water added with pomegranate juice. Has to be given. That means plain water is not given. In Ayurveda, plain water is not given in this condition. Suppose if the patient is an alcoholic, then you have to give him diluted alcoholic brew prepared from wheat and barley, goduma and yava. It may be our beer.
Yes.
Okay. There are maybe some 200 different alcohol preparations mentioned in Ayurveda. We have lost them, I think. Okay, we have not given much importance for all that. Okay, Varuni is there. Varuni also can be one of the type of alcohol preparation. And then grape wine, diluted grape wine has to be given. So here one thing, when he feels thirsty, only to quench the thirst.
Right.
Okay. And maybe it's a galloping disease. It is called as a galloping disease. It increases, especially when it becomes pulmonary tuberculosis. There, the treatment is something very astonishing, surprising. There, you have to give steam bath, boiling water with goat head meat. Goat head meat. It's simple, no? In a cooker now today it is simple. In a cooker, keep goat head meat, or you want to fry it, whatever you want to do it. So add water, remove the vent weight, have a nozzle to that hose, then keep boiling it. So you can give, specially to the back, not to the front, not to the face. Eye should be covered. To the back and entire body, steam has to be given every day, applying Vatahara Tailas. And depending on the symptoms, condition, there are some preparations also, medicines prepared, yogas, okay, using this ajamamsa, goat meat. Okay. You also today get in market medicines prepared out of goat meat, Ayurvedic medicine. Bruhat Chagaladi Grita. This is produced by Kottakal Arya Vaidya Shala. And even this other lehyas, Ashwagandha lehya, even there also they have added, that is with and without also you get. Okay. So with the goat meat soup. And then he has to wear mani, japa mani. Yeah, he has to be decorated. He should be very clean. Every day he should take bath. 3 or 4 times he has to clean. His danta davana has to be done. Okay. And then he should be very happy, feel happy. And he has to pray God. Adi Daivika Chikitsa. Adhyatmika Chikitsa, all we have given. Adi Daivika Chikitsa. He has to pray. He has to chant. Okay. So that any god prevailing at that time, it has been mentioned. Maybe Shiva, Narayana, Lakshmi, all these are mentioned. Okay. So like that today, depending on their community, their thing, they have to pray their own god to be good. Right. To be good. What is God? Good is God. Okay. This is one thing. So like that, We also have very similar to this diet we have for diabetic mellitus. So here madhumeha. Madhu means honey. So meha means urine, passing urine. So he is passing something like a honey. That means it is sugar he is passing. Okay, that's why. So here also the same diet. What I have seen, see in madhumeha, in diabetic, I told you, 3 palas of rice. When that 3 palas has to be reduced, and 1 pala of dal has to be increased. Bring it to equal. Okay. So that should be given. When the patient is given served rice, then you have to serve him with horse gram dal. Anything prepared. Very tasty it should be prepared. It has to be given. See in diabetic, madhumeha, there are 2 categories of patients. Okay, you might have seen diabetic people nowadays, even the born baby may be diabetic because it is type 1. The islets of Langerhans are absent. The other one, the type 2 diabetic, see one patient will be very hefty, overweight. He is also diabetic. Another person will be very thin and weak. He is also diabetic, type 2 diabetic only. So in this, the treatment will be common, but the first category, the hefty patient, has to be prepared for receiving this treatment. That means he has to undergo shodhana karma, especially virechana karma. Okay, it is done whenever the patient is needs shodhana karma, or in seasonal elimination of doshas. It is done in rainy season. What I have assessed is, it should be given at the atmospheric temperature around 35 degrees centigrade during rainy season. Once in a year it is given. It is simple. This procedure is of 3 stages: pre-procedure, the main procedure, and the post-procedure. In the pre-procedure, assessing his digestive capacity, we give him ghee. How much ghee you take per day?
2 tablespoons.
2 tablespoons. You are here assessing the patient and the rate of elimination. So there are 3 categories: avara, madhyama, and pravara. Okay. I will tell you about pravara. That means we give him so much ghee, melted ghee, cow ghee, that he will not feel hungry for 24 hours. Madhyama is 12 hours. Avara is 6 hours. Okay. The thing is, he will not have appetite. Hunger is vanished, but he develops thirst. Enormous thirsty. Okay. He keeps on asking for water. Okay. Always give hot water. We give him hot water. And another thing I have observed, all the water he drinks, he keeps it in his body, the production of urine will be less. Okay. Lot of water he will take. How much water he takes, in my experience, I have found out, 1 cc of ghee requires more than 10 cc of hot water. That means you give him 100 grams, he will be taking a liter of water. Okay. All that increases the circulating blood. It is circulated, and then it is being, the next day, the pradhana karma is given virechana for purging, so entire thing will be flushed out. Then we take him for the treatment of madhumeha, diabetic. Okay. The last stage, that is the part, that is the post the karma. There we have to give, as per the digestion, we have to kindle the digestion, because the digestion will be very less. So there also different varieties, including the rice water, boiled rice water, and then fruits, and even this aja mamsarasa, goat meat soup, and dal soup, everything. And later it takes, to prepare him for normal appetite, it takes some time. Okay, so this is the one. And now here also, for this patient, when he feels thirsty, yes, please keep it in your mind or underline it in your mind. When he feels thirsty, to quench his thirst, we have to give him hot water mixed with triphala. The triphala, one should always remember triphala. Okay, triphala is a very important thing in diabetic. So triphala water is given. Amla juice water. You know amla?
Yes.
Amalaki, nalikai. Amla juice. In triphala also amalaki is there. They are all dried form. If fresh is available, you can give fresh juice in water, added with honey. See, added with honey. Little honey you had, and you have to give. So this is the intake of water when he feels thirsty. Okay, and another most important is vyayama, exercise. He has to do exercise. This disease comes because of asya sukha, swapna sukha, dhadini, gramya, audaka, pranipakshi. That means always sitting, always sleeping, no worry at all. Okay, and then eating lot of milk and milk products, including curds. Okay, eating navadanya. Navadanya means always to use the rice, it should be 1 year old. So here they eat the regularly, if they use navadanya, fresh yield rice within 1 year. Okay, and then the caged birds, caged animals, anupa. Anupa means marshy animal. That is, it may be pork, it may be a buffalo. Okay, all these. So with that they get.